Ozbolt, MD, Assistant Professor of Clinical Psychology and Behavioral Sciences, Director, UHealth Eating Disorder Program, Department of Psychiatry and Behavioral Sciences, Dr. Lauren Ozbolt. Welcome to the show.
Thank you so much. Thank you for having me.
Oh, it's our pleasure. Now, please tell us a little bit about eating disorders in America today.
Well, I don't think you have to be a doctor or in healthcare, or maybe you just have to have a pulse to realize that this is a very rampant problem in America. From the checkout line at the supermarket with all the magazines, it's something that is constantly in the attention of the media. It's something that's constantly on people's minds, and it is greatly increasing.
Now, you mentioned the magazines at the checkout line in the store. Is that because it provides such an unattainable image for the American public?
I mean, I think we're always probably fascinated with what stars do and the inner workings of their lives. But yeah, I think that there is an unattainable image there that that people want to kind of lust after.
Well, you know, this is a problem that most people have known as a problem for quite some time. I'll go back to my college days when I went and all the sorority girls were breaking their fingernails, sticking it down their throat and throwing up. I mean, America's known that there's an eating disorder problem for a long time. Is it on the rise or the decline? You would think it would be on the decline with everybody having knowledge of it.
You would think, but actually that's not so. You know, it's sad. 20, 30 years ago, people that treated eating disorders were more your internal medicine and your adult psychiatrist. Today, it's something that's in the child psychiatry field that is mainly addressed by pediatricians, at least initially. So we're starting to see them younger than ever before.
Horrible.
Yeah, and we probably don't have any really good statistics about how prevalent it is. Our statistics tell us it's like 1-2% of the population, but we see it clinically way more than that.
The victims are not exactly the type of person that are going to stand up on a box and say, hey, I've got a problem.
That's exactly correct.
Now, how much impact do you feel that the media's had on this? I think you talked about that a little bit at the checkout counter, but how about all of the red carpet? Every time the red carpet goes through, you must have a spike in phone calls.
Yeah, I mean, it is something that's very glamorized, and unfortunately, it's rewarded in our society to be very thin, and there is really not a standard of what is too thin in the media or in the celebrity circuit.
I'll tell you what too thin is. Too thin is when I lost my 40 pounds and I really had lost 45 and somebody came up to me and said, you look like death. I said, that's it, and I started eating pasta. I couldn't take it anymore. Now, I'm a man, and I lost those 40 pounds, and I found when I was at the bottom of when I was starting to really be at the end of my weight loss, that it was sort of a mechanical thing, and it was almost impossible to stop. And I'm a man. Do men have this problem, or just women?
Well, predominantly we see it more with women. Anorexia nervosa and bulimia nervosa, which are our two eating disorders, or what we think of mainly as our eating disorders, affects about 85 to 95% women. Binge eating disorder, which doesn't have the behavior of vomiting or laxatives or compensatory behavior, that affects men. You know, we see more like 60% women in that.
Yeah, binge eating, we call that beer and chips. Now, let's see. Is there a specific age where this starts to happen, or is it like older people too? Can this happen to like somebody when they come out of school, when they're redefining themselves? Because it sounded to me like you said the younger people, it starts when they're defining themselves. So I got to figure when you graduate college and you're redefining yourself, it might happen too.
Yeah, that's true. There's really a bimodal peak. We start to see it at the beginning of adolescence, the pre-adolescent period, right before 12, 13, 14 years of age. And then we start to see it again in young adulthood. In the college years, especially on college campuses, it's a huge problem. So really, those are the two times that we see the peaks.
Now, what are the main disorders and what are the signs? You said bulimia and anorexia. Is it just looking for somebody that's a stick figure? Is it like weird hair? What are the real telltale signs for the moms and dads out there that want to know, that maybe think, what could they look for?
Okay. Well, let's start with anorexia. Anorexia, by definition, the person has to be thin. Actually, they have to be less than 85% of their ideal body weight.
Okay.
In addition to that, they have to have a denial that they are thin or that they have any kind of problem. And they have a disturbance in the way their body weight or shape is experienced. They may be 70 pounds, but they feel like they're obese.
Oh.
In addition to, technically by the definition, they have to, if they're a woman, they have to be without their menstrual cycle for 3 months. That is our classic anorexic picture.
Okay.
When we talk bulimia, we're talking someone who is normal weight to maybe slightly overweight, who engages in binging and purging episodes. Binging is when you eat a quantity of food in one sitting that is much greater than an average person would eat it, and you have a feeling of being out of control. You have to have 2 episodes of that a week, as well as compensatory behavior, which would be the vomiting you referred to earlier with the girls losing their fingernails, the over-exercising, laxatives, diuretics. Those are our 2 main eating disorders.
Now, we only have a minute left, according to my friend Juan, the American hero. Now, I'd like to know what treatments are available and how somebody can get help from a UHealth physician on this issue.
Well, the University of Miami has just started a new eating disorder program, and the first step would be to call for an initial evaluation. A comprehensive evaluation is what is needed by a psychiatrist, a psychologist, nutritionist, internal medicine, and we help facilitate that and are able to do all of that at the university. In addition, we are able to have an inpatient program that provides sustenance for the malnutrition, so you can be admitted and refed under close doctor supervision at UMH.
Now, Lauren, how does somebody get a hold of you? Is there a website, a phone number? I want to make this simple. Hold on a second. People, get your phone number, get your pencils ready, because this is an important number. If you or a loved one has a problem with an eating disorder, Lauren, go.
The best number to call is 305-243-6400. This is the direct line to make an appointment for a comprehensive evaluation of a potential eating disorder or a potential eating problem.
All right. Well, Dr. Lauren Ozbolt, MD, from University of Miami Health System, we call them UHealth on our show. I want to thank you so much for bringing such important data and information to our listening audience. Are we going to go to a break, or we have Clem holding? What should we do, Juan? We're going to go to a quick break, and I'm going to ask Dr. Clem Beazold to please hold. We're going to be right back with Dr. Clem Beazold. We're going to look into the future of what medicine is going to look like in 2015. Again, thank you to Lauren Ozbolt, MD, and University of Miami Health System, UHealth, for your special attention today.
Thank you for having me.
My pleasure. Back after this.